ashver.com.
Hello and welcome to ashver.com. You are watching an interesting and informative video on how to stop, reduce or alleviate aches and discomfort, gadgets and devices for pain relief.
Please read the disclaimer carefully.
Gadgets and devices for pain relief. There is an increasing arsenal of gadgets on the market that claim to alleviate or reduce pain. These pain-relieving devices have a number of advantages over the use of drugs. They have less side effects. They save money on prescriptions. They can be administered directly to the point of need. So what are these gadgets? At the simple end of the market we have devices that apply either hot or cold surfaces or a magnetic field to alleviate pain. At the more complex end of the spectrum are transcutaneous electrical nerve stimulator, TENS, machines and sonic pain relief devices. Before we look at these devices in more detail, the key question is which ones really work? Do these devices stop pain? Real clinical evidence that they banish pain is hard to come by. However, it can be shown that all of these remedies contribute to pain relief in a significant number of individuals. It must be remembered that some people will experience real relief from pain even when a remedy with no clinical basis is applied, just as some people will experience relief from a real illness when given a sugar pill. This is known as the placebo effect. The impact of the placebo effect can be tested by using a double-blind experiment where 50% of patients are given the real treatment and the other 50% a treatment that seems real decent. For example, if the treatment involves, say, wearing a copper bracelet, the other 50% will wear a bracelet that looks like copper but isn't. The key to this type of study is that no one involved in the trial knows who has the real treatment and who has the placebo. If the cure has no clinical basis, then the results will show that both groups have a similar percentage of those who report an improvement. In other words, the improvement is because of the placebo effect. This doesn't mean that no pain relief has taken place, but that the reduction in pain is due to the belief in the treatment rather than the treatment itself. In other words, the sufferer's belief alone may be sufficient to trigger the body to reduce the level of pain. Producing hard clinical data that can be verified is much harder than a testimonial from a satisfied user, and any misrepresentation of the truth leaves the supplier open to lawsuits and prosecution under consumer protection law. So let's look at some of these therapies, beginning with one of the simplest, magnetic therapy. There are a huge number of magnetic-based products that claim to reduce pain. It is important to understand there is no strong medical understanding of how these products actually work. Research has shown that a product with just an ordinary magnet embedded in it is unlikely to relieve pain. There is limited clinical evidence, Journal of Alternative and Complementary Medicine, to suggest that more powerful, active magnets, electromagnets, can impact on pain and reduce it. Product specifications vary widely, with some producing a static magnetic field and some producing an oscillating field. It is obviously important, if you want to try magnetic therapy, to research products carefully and buy from a reputable supplier. Make sure the product is appropriate for the type of pain you suffer from. For more on magnetic heat and cold treatments. Pain can often be eased by applying either a hot or cold object to the appropriate area. As a simple rule, cold treatments, for example an ice pack, is good for pain relief, while heat treatments are good for stiffness and aches. The decision whether to use either heat or cold treatment for a pain caused by, for example, arthritis depends on the type of arthritis and should be discussed with a medical practitioner such as a doctor or physiotherapist, physical therapist. Moist heat, provided by a hot bath or shower, or dry heat, such as a heating pad, placed on the painful area of the joint for a few minutes may provide pain relief. An ice pack, or even a pack of frozen food, wrapped in a towel and placed on the painful area may help to stop the swelling and relieve the pain. Products are available to generate either heat or cold via a chemical reaction within a treatment pad. These can be applied when out and about when you don't have access to a fridge or saw. TENS machine therapy. TENS machines work by delivering small pulses of electricity to the surface of the body via electrodes attached to the skin. This means the user can target pain in particular parts of the body. Research has so far produced conflicting results about how effective TENS is and exactly how it works. It certainly reduces pain for some people, but the amount of pain reduction varies for each individual. It appears that the TENS machine interrupts the transmission of nerve messages to the brain relating to pain. The machines have two modes of operation. The higher frequency mode appears to stimulate non-pain transmitting nerves, so blocking pain signals to the brain. The second mode, where lower frequency pulses are used, appears to stimulate the production of endorphins. These act rather like painkiller drugs in that they block pain signals. TENS machines are most effective for pain in joints, nerves and muscles, and are not normally effective for chest, abdomen or head pain. There are hardly any side effects, and TENS machines are highly portable, so you can move around while treating yourself. It is obviously wise to consult a medical professional before using and following the directions very carefully. TENS machines shouldn't be used by people with certain conditions, including pregnancy or those with pain. Sonic pain therapy. Sonic therapy relies on the use of sound rather than electricity as used in the TENS machine. Sound waves are directed into the skin towards the source of pain. While the TENS machine helps reduce pain by blocking the pain signals, sonic therapy actually reduces the cause of the pain. You can think of it a bit like an internal massage. The frequency of sound waves is measured in Hz, Hz, so 1 oscillation a second is 1 Hz. Sound waves of less than 16 Hz are known as infrasonic, can't be heard by humans, 16 Hz to 20,000 Hz as intrasonic, maximum range of human hearing, and over 20,000 Hz, ultrasonics. Ultrasonics are used for diagnostic purposes, for example to produce an image of a fetus, while therapeutic sonic therapy devices use either ultrasonic or infrasonic waves. These waves travel into the skin and cause the cells making up human tissue to resonate. This creates a highly effective massage effect underneath the surface of the skin. This tends to expel toxins and excess fluid from cells and promotes healing and improves blood flow. These devices can also be used alongside a TENS machine, so the two therapies can complement each other. Sonic pain relief devices are portable, and suitable models for home use are readily available. Pain relief gadgets. If you want to find out more about pain relief gadgets, then have a look at what is available online. These pain relieving gadgets devices necessarily replace drugs for pain relief. However, even if they don't totally kill the pain, they can be a useful way of achieving additional secondary relief. They can also contribute to removing the source of pain by reducing swelling. Thank you for watching this interesting and informative video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find a lot of interesting videos on wide range of topics here. Stay tuned and keep watching.